Dr. Krishna Prasad, Radiology Resident, Srinivas Institute of Medical Science and Research Center, Bangalore. My topic is Overview of Breast Manifestation and Systemic Disease. Introduction. Although much emphasis has been placed on primary presentation of breast cancer, little focus has been placed on how systemic illness may affect the breast. Women exhibiting breast manifestation of systemic disease may present with varying symptoms mimicking cancer. It is important for radiologists to have an awareness of other disease which can affect the breast. Objective: we summarize the key featuring including background pathology, clinical signs, and imaging features of each disease type covering. Diabetic mastopathy, an uncommon benign fibrotic disease equally as prevalent in men and women, is strongly associated with long-standing type 1 diabetes. Pathology: hyperglycemic state can cause increased collagen production and decreased degradation, resulting in focal extracellular matrix expansion, giving rise to dense tissue. Signs: large, painless, hard breast mass, multicentric or bilateral involvement. Imaging: mammography, dense tissue mass with asymmetric density or architectural distortion with features suggestive of malignancy. On USG, hypoechoic mass with marked posterior acoustic shadowing. These are the image of cardiovascular disease. Affects almost every organ including breast, often found on concurrent imaging. Signs are background linear venous calcification, venous engorgement and edema. Imaging wise, mammography, skin thickening, increased density and arterial calcification longitudinally along the periphery as two straight parallel calcium deposits. On ultrasound, venous engorgement and hypoechoic changes mimicking mass. These are the images of the following. Infectious disease, tuberculosis mastitis. TB mastitis is very rare. It is being called the Great Masquerade due to multifocal presentation. It can be direct inoculation of bacilli through lactiferous duct secondary to primary infection, or rarely due to direct extension from chest wall. It is important to differentiate TB mastitis from granulomatous, as steroid treatment for granulomatous mastitis causes a flare of TB. Signs are hard, painless, poorly defined mass, associated skin nipple retraction, axillary node involvement, fistulation, sinus tract. On imaging wise as mammography, three distinct patterns are seen: nodular, diffuse, and sclerosing. Nodule is well circumcised. Diffuse multifoci with sinus tract and skin thickening mimics inflammatory breast cancer. Sclerosing, extensive fibrosis also mimics carcinoma. On ultrasound, can be cystic or solid mass, MRI enhancing heterogeneous mass. These are following images. Systemic inflammatory disease, seen in women, childbearing age, and response well to steroid. Signs are firm to hard masses that involve any part of breast. Subareolar region may be relatively spared. Nipple inversion, skin thickening, sinus tract, unilateral or bilateral. Imaging wise, on mammography, normal masses, focal asymmetric density, dilated retroalveolar duct, large lateral stage tubular and spherical calcification with lucent center. On ultrasound, mass-like appearance, tubular, nodular, hypoechoic structure with and focal decreased parenchyma with acoustic shadowing, echogenic acoustic shadowing. On MRI, multiple enhancing lesions are seen. These are the images of the following. Systemic inflammatory disease, sarcoidosis, a multi-system disorder characterized by pathological non-caseating granulomas with wide range of clinical and radiological manifestation. Breast involvement is rare and usually associated with pre-existing disease. Signs are mass or intra-mammary lymph nodes. Imaging wise, on mammography, irregular, ill-defined or speculated masses which mimic carcinoma. Occasionally, breast sarcoid may present as well-defined masses that represent inflammatory lymph node involvement. Calcification is absent. On ultrasound, well-defined hypoechoic granuloma mimics carcinoma, required core biopsy. These are the images of the following. Then scleroderma, connective tissue disorder that produces sclerosis of skin Etiology is unknown, has been reported in patients with breast cancer treated with radiation therapy and after silicone breast implantation. Signs are erythema, retracted and indurated skin, skin tightening, calcium deposits, patulous esophagus, pulmonary fibrosis. Diagnosis is confirmed histopathologically. Imaging-wise, in mammography, coarse calcium in breast tissue. On MRI, replace of subcutaneous and breast fat by low signal, non-enhancing tissues. These are the images. Then hematological disease. Lymphoproliferative disorder rarely involves the breast and manifests commonly as primary lesion or part of a generalized process. It can occur in all with median age of 50 years. Signs are unilateral or bilateral palpable mass, pain, night sweats, fever, weight loss. Imaging-wise, on mammography, solitary mass oval or round in shape with the circumscribed or indistinct margins, no calcification. On ultrasound, irregular, bizarre, hypoechoic mass, single or multiple, unilateral or bilateral, enlarged intramammary and axillary lymph nodes. Lymphoma are usually hypervascular. These are the ultrasound mammographic images. Conclusion: radiological features of systemic disease in breast may mimic those of malignancy, causing a diagnostic challenge even in underlying disease is known. After excluding primary breast malignancy or benign pathology, evaluation for systemic disease should be considered. It is important for breast radiologists to understand other disease giving rise to breast manifestation. Reference are like this.